Hello everyone. In this video, I'm going to talk about Carvedilol. Carvedilol is a medication that has a dual action. It acts as a beta blocker as well as an alpha blocker. However, the beta blocking activity is non-selective. It is well known under the brand name Coreg. Carvedilol blocks the activity of your heart, but still it maintains cardiac output and is used in heart failure. It reduces your blood pressure. However, it also blocks reflex raise in your heart rate. In this video, we are going to discuss such interesting facts about this medication. Carvedilol, like how this medication works, how to take this medication, and what are the important precautions and side effects. First of all, let us see where it is used. Carvedilol can be used in the treatment of hypertension. It can also be used to control the heart failure that is associated with hypertension. It can be used along with diuretics or ACE inhibitors to reduce the need for hospitalization. Therefore, it can be used in people with mild to severe chronic heart failure, as it is maintaining the cardiac output. It is also used in the treatment of left ventricular dysfunction that may be observed after myocardial infarction. How it works? Carvedilol helps you restore heart conditions in many ways. It acts on the alpha-1 adrenergic receptors located on the arteries, where they are actually responsible for constriction and an increase in the blood pressure. Carvedilol blocks these alpha-1 adrenergic receptors, which increases the vasodilation. This decreases the resistance and improves the blood flow. Carvedilol can also non-selectively block the beta-adrenergic receptors. Beta-1 adrenergic receptors are mainly expressed in the heart. Since Carvedilol is going to block the beta-1 receptors, it can reduce the activation of the heart. Even it can suppress the reflex mechanism. Normally, vasodilation may result in the stimulation of the heart, leading to reflex tachycardia. However, Carvedilol can also block the heart, therefore, it can prevent the reflex tachycardia. This medication can also maintain the cardiac output. Unlike other beta blockers, it has less effect on reducing cardiac output. Since Carvedilol produces vasodilation by relaxing the arteries, it can improve the blood flow. This reduces the afterload, thereby it may increase the cardiac output. Apart from these actions, Carvedilol can also have antioxidant and anti-inflammatory properties, which also reduce damage to the heart and arteries. By all these actions, Carvedilol can be useful in reducing the blood pressure as well as in maintaining the cardiac output in people with heart failure. How to take this medication? Carvedilol can be taken with food. When it is taken with food, it reduces how fast it absorbs into your body. This reduces the incidence of postural hypertension, dizziness, and risk of syncope. The dose of this medication is individualized based on the patient's conditions and body weight. However, in most of the conditions, it is started at a low dose in order to avoid hypertension and dizziness in the people. Carvedilol is available as immediate-release tablets, as well as extended-release capsules. The dose also depends on which type of formation you're going to use. For the treatment of congestive heart failure, it can be given at a starting dose of 3.125 milligrams 2 times a day for up to 2 weeks. Then the dose may be slowly escalated such that the total maximum daily dose is 25 milligrams given twice daily. If you are taking capsules, it is started at 10 milligrams, given only once a day. After 2 weeks of treatment, the dose may be increased to a target dose of either 40 to 80 milligrams per day based on the requirement. For treating hypertension, it can be started at higher doses. It is given at an initial dose of 6.25 milligrams given twice daily. After 2 weeks of the treatment, the dose may be increased, and the target dose is 25 milligrams twice daily. In the case of extended-release capsules, it is started at 20 milligrams per day. Now let's see the important precautions. If you are using Carvedilol for the treatment of coronary artery disease, you should not suddenly withdraw this medication at any time. Particularly before the surgery, beta blockers like Carvedilol should not be withdrawn suddenly, as it may increase the risk of myocardial infarction and ventricular arrhythmias. You may not have any warning symptoms of angina before the development of cardiac arrhythmias. Therefore, Carvedilol should not be suddenly withdrawn and should be discontinued over 1 to 2 weeks. Many of the times, coronary artery disease is not completely recognized, so sudden withdrawal of Carvedilol may increase the symptoms of angina or cardiac arrhythmias. In case if you notice worsening symptoms of angina, like severe chest congestion, tightness, and shortness of breath, you may be suggested to reuse this medication, at least temporarily, to restore the condition. Carvedilol can reduce your heart rate and may produce one of the conditions called bradycardia. This is common with this medication, as it blocks beta receptors on the heart. However, when your heart rate is reduced to less than 55 beats per minute, the dose of this medication should be reduced. Carvedilol can reduce your blood pressure, and it may produce one of the conditions called postural hypotension. It is a drop in the blood pressure when you change your posture. It may increase the risk of falls and syncope. Postural hypotension can be clearly observed when you increase the dose or when you suddenly discontinue the dose. These effects are more observed during the first 30 days of dosing with carvedilol. It can also increase the dizziness, particularly in the elderly people. Those people who are switched from the highest dose of immediate-release carvedilol to extended-release carvedilol again experience some dizziness. Postural hypotension and syncope can be minimized in many ways. Reducing the dose, taking it with food, and gradually increasing the dose may help this condition. After several days of treatment with a low dose of carvedilol, when you increase the dose, you may observe worsening of heart failure due to fluid retention. In such conditions, your doctor may increase the dose of diuretics to reduce fluid accumulation in your body. These effects may be observed for 3 months when you increase the dose. So within this period, you should clearly monitor any worsening symptoms of heart failure. In the people with non-allergic bronchospasm, like chronic bronchitis or emphysema, carvedilol should be carefully used. Since this drug blocks beta-2 adrenergic receptors, it may increase the bronchospasm in such people. Carvedilol may mask the symptoms of hyperthyroidism in people with excessive thyroid levels. It may increase the symptoms of arterial insufficiency in people with peripheral vascular disease. When this medication is used for treating hypertension in people with heart failure, a reduction of renal function may be observed, particularly during the higher doses. In such conditions, the dose may be reduced, or temporarily, this drug may be discontinued to restore the condition. Side effects. The main adverse effects of carvedilol are related to its hypotensive effects. You may have dizziness, hypotension, fatigue, and diarrhea. It can also increase your weight and produce hyperglycemia. Other side effects like bradycardia, nausea, headache, edema, and difficulty breathing can be observed. Carvedilol may also lead to the worsening of hyperglycemia, which may further increase the hypoglycemic therapy. You should monitor the glucose levels, particularly when this dose is initiated or increased or even discontinued, where it is avoided. If you have bronchial asthma or serious breathing problems, carvedilol is not suitable to you. In people with second-degree or third-degree heart block, use of carvedilol may further increases the risk of heart block. Therefore, it should be avoided. People who are taking intravenous inotropic therapy for either cardiogenic shock or decompensated heart failure should not use carvedilol. In people with sinus bradycardia, use of carvedilol should be avoided. Especially if your heart rate is less than 45 beats per minute, carvedilol should not be used. These are the important things that you should know about carvedilol. That's all, guys. Thanks for watching this video, and if you find any interesting facts on this medication, please share them in the comment box below. Please do subscribe and hit the like button. I will come with another interesting video in the next week. Until then, have a nice time, take care, and goodbye.